Lorain County acts on opioid overdose. We are students in the Amherst Steele Medical Health Technology Program. We are your future in healthcare. We appreciate you answering the survey questions before you watch this video. We hope you can answer the post-survey at the end of your physical therapy prescription, as well as another one in 3 months.
Our current class project is researching accidental opioid overdose deaths in Lorain County. According to our findings, overdose deaths have risen since 2019. Opioid addiction affects everyone and our future. We want to live in a county where residents have prevention and recovery services readily available. As a class, we have discovered there are many county resources available, but you might not be aware of. In the video and the packet we have provided, we hope to get you valuable information out to the community. Opioids are drugs that depress or relax the activity of the nervous system, decreasing feelings of pain and affecting breathing. Some examples of opioids include heroin, oxycodone, hydrocodone, fentanyl, and morphine, to name a few.
Education is key to prevention. Ideally, we want to prevent people from being addicted to opioids. Addiction is a chronic relapsing brain disease that is characterized by compulsive drug seeking and use, despite having harmful consequences. Drugs change the brain. These changes can be long-lasting and lead to harmful behaviors for people who use drugs. We have the Mental Health, Addiction, and Recovery Services Board of Lorain County. This agency is a great start to learn more about addiction and mental health services for those in Lorain County. Check out the link in your education packet. What can we do now to prevent misuse of or abuse of opioids? Get unused medications out of the house. Do not flush them down the toilet or save them for just in case. There are many drug disposable options available in Lorain County. Please refer to your education packet for exact details.
While we are sad to see you in physical therapy because that means you have an injury and may be in pain, you are in the right place for pain management. Opioids are commonly prescribed to help with pain management for injuries. When used correctly under the guidance of a healthcare professional, they can be safe. However, research supports other alternatives for pain management. Physical therapists and athletic trainers are excellent resources for discussing pain management alternatives. Over-the-counter medications, ice, heat, ultrasound, electrical stimulation, exercise, dry needling, and soft tissue immobilization, massage are just some options to help relieve pain as well as help with the healing process. Take this time to learn more from your physical therapist on alternatives for pain management.
What if the unimaginable happens? You find yourself in a situation where someone may have accidentally overdosed. Would you know what to do? Sometimes the hardest part of putting this plan into action is recognizing there's an emergency. If someone is unconscious and not responding, this could be an emergency. According to the American Red Cross, you need to first check the scene to make sure it's safe for you. Then check the victim. You will then call 911 immediately. After calling 911, you might need to provide care to the victim. Care may include CPR and/or the use of Narcan. Shannon will talk in the next section about Narcan. Learning CPR and first aid skills are easy. You can contact your local American Red Cross or American Heart Association for local classes. There are no good reasons not to call 911. However, some people may be afraid to call 911 because they do not want to get arrested due to the drugs at the scene. We asked Officer Layfield from the Amherst Police Department to explain the 2016 updated Good Samaritan law.
In 2016, former Governor Kasich signed House Bill 110, which is usually called the 911 Good Samaritan law, which says that if you call the police because somebody's overdosing or you're overdosing because of drugs, we can't charge you with the drugs that you have in your possession at that time. Personal use amounts of drugs, misdemeanor type of drugs, or felony 5 types of drugs. We cannot charge you. We have to get you medical aid, and you get to go away free.
Nate has mentioned the use of Narcan. If someone has accidentally overdosed, Narcan, also known as naloxone, is a medication that may help someone survive an overdose. Lorain County Public Health offers a naloxone kit weekdays from 8 a.m. to 4 p.m. at 988 South Murray Ridge Road, Elyria, Ohio. After hours are available. Call the schedule at 440-322-6367. Please allow 20 minutes for education on how to use. This is available from the Project Dawn grant. To make it even easier to get Narcan, you can order it by mail. Simply go to Lorain County Health's website, complete the form, and training online.
Despite all efforts, sometimes friends and family become addicted. Amherst is the place to start to help set up a recovery plan as well as provide support to family and friends. In your information packet, we have provided an information sheet to get you started. If you haven't noticed, we have referred to the Amherst board for nearly every answer in our survey. The Mental Health Addiction and Recovery Services Board of Lorain County is the name to remember and the place to start to help decrease accidental opioid overdose deaths. Your physical therapist or athletic trainer is also a great source for pain management without the use of opioids. You are one internet search away from finding an American Red Cross or American Heart Association CPR/first aid class. We hope you will be able to answer our 3-month survey. Thank you for participating in our research project. Thank you for your help from the Amherst Steele High School Medical Health Technology Program.